All right. Good morning, everyone. Welcome to Facebook Live. Today we are asking a nurse about norovirus. So my name is India Richards, and I am a community health worker manager. And we are going to talk about something that no one really wants to talk about, but it's here, and we definitely need to get talking. So we are going to talk about the norovirus today, and we're going to get some tips from someone who is on the front lines of the norovirus situation in the community, and that is Kat Romer, and she is a school health nurse. So, Kat, just to get started, can you tell us a little bit about yourself, please?
Yeah, I am a nurse for 20 years. Pediatrics has been my specialty. I've been with the health department for a year now. In school health, I work in elementary schools, and yeah, it is time to have this conversation about norovirus.
Absolutely. All right. So I know that as a mom, and in talking to you earlier, you're a mom also. So, like, when our kiddos get sick, inevitably they are going to bring it home to us. And I want to stay healthy and I want my babies to stay healthy. So, can you just start us off with some basics? Like, what is the norovirus?
Absolutely. So, a lot of people refer to it as stomach bug, stomach flu. It's not related to our influenza viruses, which we have out there now. It's norovirus is the virus that causes the stomach bug. The symptoms are vomiting, diarrhea, abdominal cramping, nausea. And it's a virus. It is an extremely contagious virus. That's why, as a public health nurse, we don't like to see that it's starting to spread because it spreads quickly. And yeah, I'm excited to have this conversation because a lot of people may not know the tips or tricks on how to clean properly or the best way to prevent getting it and spreading it.
Absolutely. Thank you.
Mhm.
So, just related to what's going on in our community right now, what are you seeing as a school health nurse?
So we are seeing an uptick in the amount of health room visits and absences related to vomiting and diarrhea. As simple as that. And uh, what I'd like to relay to the public is it sort of seems as a parent an inevitability. You're going to experience this. You're going to get the dreaded stomach bug. Um, but I'm hoping to sort of give people an idea of what we can do to avoid the spread. When you are infected with the norovirus, it replicates rapidly in our systems. So every time you throw up, every time you have diarrhea, there are millions of norovirus particles that are expelled. And it only takes a couple of norovirus particles to make someone sick. So, like, that's disgusting to think about. The way that it is spread is if someone comes in contact with one of those particles, and let's think about that. How are we coming in contact with one of those particles? It's likely we've touched a surface that has had that someone infected with the norovirus has been touched. So, washing your hands with soap and water for 20 seconds before you eat, after you've been outside, is the best way to keep yourself healthy.
All right. So, washing hands is number one
Mhm.
technique.
Soap
Um,
and water for 20 seconds. Hand sanitizers, a lot of hand sanitizers aren't effective at killing norovirus. They're great for flu, COVID, but not for the norovirus.
okay. Thank you for mentioning that. I was
Mhm.
just going to ask about hand
Yeah.
sanitizer. All right. And then what about like cleaning solutions?
Yeah. So another thing when we're cleaning up, so as the school health nurse, as a parent myself, as a parent, um, the most important thing to know is that bleach is the best way to kill it on hard surfaces. So you want to clean the surface that has been in contact with the vomit spray, the diarrhea, clean it and then disinfect. So you're going to clean it with something. If it's a hard, non-porous surface, clean it. The caregiver, you're going to put gloves on, clean it with, paper towels. Make sure you dispose of anything that's come in contact with the diarrhea, the vomit, and then you're going to go with a solution of 3/4 cup of concentrated bleach mixed with a gallon of water, and you're going to any hard non-porous surface, you're going to put that on the surface, let it sit for 5 minutes, and then go behind and wipe it down with warm water. That's what's going to kill the virus, is that bleach solution.
Okay. Okay.
Mhm.
Awesome. That's good to know.
Yeah,
So, if my kid gets sick, what do I need to do related to keeping them out of school? Like, how long does that look? Like what
absolutely.
is the situation and scenario for that?
Yeah. So I think one thing I want to mention, typically, if you've come in contact with the norovirus, it can take 12 to 48 hours to start to be symptomatic.
Okay.
So we don't know if we're contagious before we have symptoms, right? So the important thing to know with regards to staying out of activities, staying home from school, is we want children to be at least 24 hours episode free. So vomit free, diarrhea free, and feeling better before they come back to school. So it could be 24 hours since my child vomited last. However, they're still feeling kind of weak. They're still feeling yucky. Give them another day. But our rule is 24 hours, episode free, and feeling better. You can return to school. And it's not just school; it's other activities too. So you've been out of school all day, but yeah, maybe he's feeling better by the afternoon. Can I send him to that basketball practice? Absolutely not. No, he's staying home from basketball too. Um, and that stinks, but it's better than the spread. Like I had said, it spreads so rapidly. And what I remember when my kids were little, they're old enough
Hmm.
now to wash their hands and properly wash their hands. When they're little, we all know a 5-year old who runs into the bathroom and like, oh yeah, I washed my hands. Like, no, that sink was running for 2 seconds. So the little, it spreads so much quicker amongst the youngins because of that. So just really reiterate and encourage your children wash your hands. Um,
So hand hygiene,
I
hand
can't say it
hygiene.
enough.
Okay. So, worst case scenario, what do I do if my child gets the stomach bug or gets
Mhm,
norovirus? Like, how do I
mhm.
take care of them? How do I minimize the, potential harmful side effects of it?
Mhm. So there is no cure for norovirus. We just have to sort of let it run its course. The symptoms typically last 1 to 3 days. The biggest concern is dehydration. So the best thing you can do is encourage fluids. Um, we say typically whatever they want to drink, but the best is an electrolyte fluid. Pedialyte for children and adults is a really good option. Um, a lot of people find the Pedialyte popsicles are more palatable than the fluid. So just encouraging fluids. If they don't want to eat, don't push eating until they feel like they're ready to eat. Um, it typically is not dangerous, typically something you can do, care for your child at home.
Okay.
What we do want to look for is no urine output. If they're not having urine output for an 8-hour period, call your pediatrician, make sure your pediatrician is aware.
Okay.
If their urine is dark amber colored versus like a pale yellow like normal, call your pediatrician. The worst case scenario, they may need some intervention, IV fluids, but that is not typical. Typically, you can rehydrate with oral fluids at home.
Okay. Okay. And then as far as once they start recovering, like they're eating,
Yeah. So once they feel better, they want to start eating. Start with bland foods,
okay.
nothing with a lot of spice. Minimize dairy for that first 24 hours. So bland foods, and then as they start to tolerate that, what they're craving, and get back to their typical diet. Within a 24-hour period, once they're feeling better, they'll probably be back on their typical regular diet. But make those first couple bites of food something bland: rice, toast, applesauce, things like that.
Absolutely. Yeah, that makes a lot of sense.
Yeah.
Okay. Okay. And then I did see someone was just wondering, will any bleach work, or should they, make sure that they're getting something that says like disinfecting bleach?
So it's I don't know if we have a link to if there's going to be a link up there, but it's a concentrated bleach. So it will say uh, concentrated bleach, and bleach is bleach. So if it's a
Okay.
concentrated bleach, that's what your mixture is going to be, the 3/4 cup per gallon of water.
Awesome. Thank you for clarifying that.
Of
I appreciate
course.
it.
Hmm.
All right. So just thinking about just like some key messages and take home. So hand hygiene, right? Like that's the big one right now.
Yes, absolutely.
Okay. So warm soap and water,
Hmm.
20 seconds.
Yes.
All right.
And then also just remembering that oh, it's gross, but I'm a nurse. Poop and puke is sort of what I do. So remembering that when someone vomits, it sprays. So those particles, the norovirus particles, are tiny. So the spray can go further beyond just the toilet. So make sure you're disinfecting the area around the toilet. Clean up any splatter that you see, and then disinfect the area with that bleach solution we discussed. Oh, something else. Little kids throw up, usually get on their clothes. So anything, any fabric or material, you can't exactly pour bleach on that. So if you take any soiled garments, blankets,
Hmm.
clothing, wash it on the highest heat, and then dry it on the highest heat, is going to be sufficient to take care of those items.
That's really good to know because,
Mhm.
yeah, you get sent home with that grocery bag full of their soiled clothes.
Yes, yes,
Now I know what to do just in case. Thank you.
absolutely. Of course.
All right. Well, no, this is awesome. Very informative, Kat. I really appreciate you, stepping back from the front lines, fighting uh, puke and poop for a few moments to come and chat with us and just letting us know like
Anytime.
what we can do, to decrease the spread and if one of our kids or, family members brings it home, what we can do to stay safe and just try to help them out as much as possible.
Absolutely. I
So,
appreciate you bringing this to sort of the public's attention. Like I said, we're seeing a lot of this in the community. And if your kid's not feeling well, keep them home. Schools will understand if you call and just say, my child is not feeling well, they're going to be home. It's an excused absence if you say they're sick. So we appreciate that because that's what's really going to decrease the spread of this virus.
absolutely. Stay home if you have symptoms. I don't think we can um, iterate that enough, right?
Yes, yes,
All
exactly.
right. So, just if there's any, additional information that was not covered, people can certainly go on Fairfax County Health Department's webpage, and that is fairfaxcounty.gov/health, and get more information on norovirus as well as other resources. So, thank you so much, Kat. It was a
Yeah.
pleasure speaking with you.
Happy to be here. Thank you.
Yeah, thank you.
Bye.
Bye.